Hi, I'm Ashley Cooley, a birth, baby, and sleep specialist and mom of three. There's so much information out there, right? This show is dedicated to helping you clear out the noise so you can figure out what will work best for your baby and your family. If you're looking to learn more about your baby, gain more confidence in your parenting, and get as much sleep as you can through it all, you've come to the right place. Bringing up baby is about to get a little easier. Hey everybody, welcome back to the show. My name is Ashley Cooley. Today we're diving into a topic that every parent faces, but very few actually understand: how babies learn to chew and eat. I sat down with Juliana McLaren, a speech-language pathologist, to unpack what's really happening during feeding and chewing development in those early months. We talked about when babies actually start developing chewing skills, what that progression looks like, and what parents can do to support it, whether you're starting with purees, baby-led weaning, or something in between. You'll also hear how chewing ties into speech development later on, the signs your baby might need extra support, and a few common myths that might surprise you. So if you've ever wondered how to help your baby become a confident, capable eater, this conversation is packed with practical, reassuring guidance. So here's my conversation with Juliana. Let's get into it. Well, hi, Juliana. It's nice to see you again. Thanks for coming and joining us on the show today.
Yeah, thanks for having me, Ashley.
Yeah, so I'm wondering if you could share a little bit about yourself and what you do.
Yeah, so I am a speech language pathologist. I own a clinic called One Bite at a Time, Swallowing and Speech Services. One Bite at a Time provides speech language pathology that's really focused on feeding and dysphagia. So, dysphagia is difficulty eating and swallowing. We help people from across the lifespan. So that includes little ones, babies, NICU graduates, children with Down syndrome or autism who are learning how to eat, and adults. So we also help adults who've had strokes, people with Parkinson's who are having difficulty chewing and swallowing. We provide other services as well, including speech and language support for children, voice services for adults. I myself graduated from Dalhousie in 2021 from the speech language pathology program. I've worked in home care, long-term care, and clinics in Ontario. And then in Nova Scotia, most of my time before opening my practice was in hospitals. So working in adult and children's hospitals, doing a lot of swallowing and feeding services in those settings.
Cool. So you have quite a variety of your background. And I
Yeah,
honestly, I'm floored by, it's so embarrassing, but I just, speech language pathology wasn't something that was in my world specifically, though I do remember
yeah,
my brother when we were kids went to a speech language pathologist because he wasn't
yeah,
saying his R's or the THs or something like that. So obviously with speech, that makes sense, but it was really kind of news to me that oh, chewing, swallowing, and then okay, I guess that makes sense, but it also still doesn't. So I love to hear more about what is a speech language pathologist's role when it comes to feeding and chewing development in babies.
yeah. So what I always tell my students, because I take a lot of students in the clinic and I also teach at Dalhousie, is that all the equipment you have for speech, your vocal cords, your tongue, all those things you think about and like speech and saying your R's, you use your tongue in different ways. All of those things, evolutionarily speaking, are actually there for swallowing. So, including the vocal cords. So, the vocal cords are there to help to protect our airway. The tongue is there to help us move food around in our mouth and prepare it to swallow. So, I like to use that to explain our role in feeding and swallowing. But more broadly speaking about the profession, speech language pathologists are regulated by a professional college. So, in Nova Scotia, we have a college. You'll find similar colleges across each province. We provide speech, language, communication, feeding, and swallowing care. So that's from screening and assessment to treatment and interventions. And again, at my clinic, we work with people across the lifespan, but a lot of speech pathologists do as well. So you might find a speech language pathologist in a children's hospital working in pediatric ICU, and you might also find them in hospice at the end of life. So we really support communication, feeding, and swallowing across the lifespan.
Very cool. Okay, so at what age do babies start developing chewing skills, and what does that progression typically look like? I see babies. Obviously, I've had my own. I've seen a lot of babies. It seems like they're starting to like chew and gnaw on things maybe around 4 months or so, give or take. But that's just what I've personally noticed. So, can you explain a little bit about how that all develops with babies?
Yeah, that's a really good question. So with babies, you want to think about there is the presence of reflexes, and then we watch those reflexes over time start to disappear as they start to accept solid food, right? So the first reflex that we think about when we think about babies is actually the sucking reflex, right? So
Hmm.
when a
Hmm.
child is breast, chest, or bottle fed, they're doing a suck, swallow, breathe coordination that does change a bit over their developmental level, but it's typically 1 to 1 to 1. So they need to suck, swallow, and then breathe at this really consistent and rhythmic rate. And that's our first kind of feeding and swallowing reflex. And if you have a baby who is, breast, chest, or bottle feeding, you might hear like clicking or difficulties latching that are interrupting that reflex. That could be one example of how things don't work as optimally and how feeding can be difficult. So when we suck and swallow, it is a lot of like forward and back tongue movement. We don't need a lot of side to side movements. When we start to chew, like when we think about the mature adult chew, that's in a rotary pattern. So our tongue is moving side to side. We have tongue lateralization, and our jaw is moving diagonally, but also kind of circularly to help us to break down the food. And that's why it has this rotary name. So the first step in that is babies need to learn side to side movements of the jaw and tongue. You can find different norms or developmental milestones in different places. The ones that I like to use and that I use in my practice are from Holland Bloorview, which is a pediatric children's hospital in the Toronto area. They have a really nice publicly and available developmental milestones page on their website. Their milestones indicate that it's, somewhere around 7 to 9 months is when we start to get that side to side movement of the tongue and the jaw. The other thing that typically we would expect to start to disappear as we introduce solids and build chewing skills is the tongue thrust. Right. So again, if you're a baby who is bottle, breast, or chest fed, you have a lot of forward and back motion of the tongue to help express that milk and to help you swallow it down. But with solids, babies need to be able to accept them and not push them out with their tongue. And that's what we would call a tongue thrust. So there's differences in reflexes, there's difference in kind of coordination of the oral motor structures that we would expect as babies start to chew.
Okay, interesting. I have a couple follow-up questions from what you said. The was it breathing, suck, swallow, or maybe
Yeah,
it wasn't in that order? What
suck, swallow, breathe. Yeah.
suck, swallow, breathe? Okay, yeah, breathe. I had once heard that babies until they're a certain age swallow and breathe at the same time, but maybe it's more because that
It,
I never could figure that out in my brain. So, but maybe it's more of that cycle that they're going through. Something's different there. Am I right?
You're right. There is the rhythmic cycle that we talk about when babies. So the way that we look at swallowing is typically through either a swallow X-ray. So that is like an X-ray video, and you give people food and drink, and it has barium in it, which is radio opaque, and you can see how the food is moving like through the mouth and the throat. When we do those types of tests with babies, we can see that their soft palate and their tongue are a little bit like closer. It almost creates this like separate channel so that they can keep breathing and kind of maintain that coordination. The other thing that's different in pediatric anatomy for swallowing is that the larynx is a little bit higher. And this is something a lot of us know. Related to voice, right? So when you think about like children, they have really high pitched voices, and then over time, like around
Hmm. Hmm.
puberty, especially boys, their voice drops. That's the larynx actually descending. But people also think that high laryngeal position is helpful to protect their airway. So yes,
Oh.
That's true. The other way we look at pediatric swallowing is with an endoscope, so we can look down and see through the soft palate into the throat. But yes, there is like a difference in anatomy. But and to make it a little more complicated, the other thing that babies do to suck, right, is on like pacifiers or things like that. And
Hmm.
that actually has a different rhythm, and it's called a non-nutritive suck. But they're generally thought to be beneficial. So if you have like beneficial to each other. So if you have a child who maybe can't feed because they're in the NICU or they've got something complex medically going on, newborns will often be given like pacifiers to help them build that sucking reflex when
Mm.
they're first born. Yeah,
Okay. Okay. Oh
which
my gosh,
again
this is so
it
fascinating.
is a bit more controversial, right? And like I know in lots of typically developing children, we worry about pacifiers with like oral development and
Yeah.
teeth and
Yeah.
dental development. But what I think is interesting as a profession that helps with speech, language, and feeding is the ability to tailor interventions to the specific child. So it's true,
Mm.
like when people ask me, like, "Oh, what's your opinion on cups?" or "What's your opinion on pacifiers?" I'm like, I don't have one opinion because it depends on the child, right?
Mm.
So it's
Yeah.
true, like an older child who is still sucking on that pacifier, that's probably something that we want to fade out so that we don't disrupt their dental development. But a younger baby who's not feeding, give them that early experience, give them that oral stimulation. That's my opinion. But
Very cool. Okay. And just goes along with the fact that there is so much information out there. And this is a reason why we have the podcast, is so that we can helpfully sift through it a little bit easier. But because there's so much information out there, because every situation and person and baby is different. So
mhm,
it is trying to find that personalized care, which is great that people can access speech language pathologists or what have you to figure that
yeah,
out for themselves.
yeah,
Let's stay on the train of starting solid. So
mhm,
there's a lot of advice and information around here, and usually, we might be talking to a dietitian or someone when it comes to like the foods and whatnot. But what really matters most for if we're talking about specifically supporting the chewing skill development early on? Like, I think you had said that one of those reflexes or something is around
tongue
7
thrust.
months. Tongue thrust,
Yeah,
yeah.
yeah.
So, but we're starting kind of around 6 months. So, like, should we be starting with the purees then until they get to a more skilled, or like, yeah, just talk me through this solids business.
Yeah, that's the other big, I think, it can be kind of controversial. And I again encourage families like do what is working for you and what's working for your child. Some things to keep in mind. Yes, a lot of kids, their skill level is to start with purees, in my opinion. But if you want to build a skill, you have to challenge the system, right? So if
Mm-hmm.
you want, if you were teaching your child how to read, you wouldn't just read, like early preschool books. You'd eventually push and progress to, more difficult books. And there are kids that are like, I was this kid, I was like a 5-year-old reading Harry Potter. You might have a kid who really is showing some advanced skills in their chewing and swallowing. And I think it is okay to push them a little bit with the caveat of remember the size of their airway. So,
Mm.
I don't know when this will be aired, but like Halloween is coming up, right? A lot of like sticky small candies can be choking hazards for our little ones. So, um, where do I suggest you start? There is kind of we start with purees and then we progress up through soft foods and then into harder solids, kind of more traditional route. Then there's baby-led weaning, right? Which is we're
Mm-hmm.
giving a variety of solids, a variety of textures. And then there's also options in the middle, which I don't think a lot of people realize. But there is a method as well called BLISS, so baby-led introduction to solids. I think that that has some really nice evidence and literature, and it's kind of, in my opinion, like a midpoint between the two of them. So the other thing that
What does that include exactly? The bliss. So are we doing a combination of like getting a
yeah,
solid food and then some purees? Is that what that is going
and
with?
I think a lot of people that are doing bliss are kind of modifying the solids down, right? So if we think of something like an apple. right? So you could give an apple to your baby in the form of like an apple sauce, right? And that would
Mm-hmm. Mm-hmm.
fit with the puree. You could
Mm-hmm.
give an apple to your baby as like, a whole slice of apple, and that might be something harder for them to chew on, more like the baby-led weaning. You could find a middle ground, which would be, in my opinion, similar to Bliss, where you are giving like some shredded apple or like a little bit of like, cooked and stewed apple. So it's still got some texture for your child to practice chewing skills, but it's not as like hard as the hard solids that you would give
Okay.
with baby-led weaning. So I would say that you want to look at your child's developmental level, their readiness. There are other aspects of being ready to start solids that don't just include oral motor skill.
Mm-hmm.
So we would typically expect, which again, a lot of people know this, but we would typically expect a child to be able to maintain like an upright seated posture. For children who are more medically complex or who are unable to sit, you can have them in like a supported seat. But again, I just like for children to be steady when they're eating,
Yeah.
because that trunk control is related to the control of the food in their mouths. And you also want a child who's interested in foods. So who is like, looking at their parents eating, interested, maybe they're trying to grab food off of other people's plates, which I always think is very cute.
Mm.
But yeah, you want
But
a
can
child.
we, like, this is probably not your area, but I just gotta say, babies between 4 to 6 months, part of their milestones in development is to be interested in things and reach out and grab them and like put them in their mouths, not necessarily
Yeah,
because they want to eat it. So I still have an issue with some doctors that are like, oh, your baby's interested. Well, give them the food. They're, if they're interested, they're ready. And that's just,
yeah,
it's just not
yeah.
all the whole piece. That's not the whole
it's
piece.
it's not the whole piece, and you will have kids, and again, like I see children who have difficulty feeding. That's what I do. Yeah, maybe
Yeah.
they're putting things in their mouth, or I've seen lots of kids who are like lickers, like they'll lick everything in sight, but that doesn't mean that they're actually going to eat it.
Hmm. Don't they
Or I
use their mouths as part of like figuring things out? Like it's,
Yeah,
yeah,
yeah.
yeah,
And I love that oral motor exploration. And when we think about like another reflex, so that would be the gag, right? And that's something
yeah.
that like scares a lot of parents when they start eating. Something that, I did not coin this by any means, but something a lot of pediatric feeding therapists say is that gagging is kind of like falling when you're learning how to walk, right? Like you will gag when you're
Oh,
learning how
yeah,
to eat.
yeah.
But it can be scary for parents, it can be uncomfortable for kids. That oral motor exploration and learning the boundaries of their mouths is one of those things that helps them to kind of integrate that reflex. And yeah, absolutely. So but you're right, like it's different to stick a toy in your mouth versus to like effectively chew and swallow a carrot.
Yeah, yeah.
So you do I don't recommend a specific method in my practice, of like, purees, baby-led weaning, or the bliss. I do like to see children kind of where they're at developmentally. And I will look at things like their tongue lateralization skills, their chewing force, and then I'll make recommendations from there. I would say as well, if parents have questions, I think she's been on your podcast, but Edwina Kennedy from My Little Eater.
Yes.
Yeah,
Yeah,
she has
yeah.
very good information about like how to modify solids, in a way that might make parents more comfortable. And I
Totally.
can't
Yeah.
I can't talk about this without again just mentioning choking risk. And I will
Hmm.
say one thing about baby-led weaning that I'm surprised that a lot of people don't know is that there is evidence that children who do baby-led weaning choke more often. So if you are doing baby-led weaning with your kids, again, I think families need to do what works for them. But I do think it's important for adults in that household to be trained in like CPR, if you're doing baby-led
Mm-hmm.
weaning. Yeah.
Yeah, and that's where we can refer to Edwina and My Little Eater because I know sometimes they partner up with like first aid things with
Hmm.
that, but also
Hmm.
just okay, if we're going from purees to solid like more solids, or we're doing this baby-led weaning and we're giving them little bits of food, they have so many great resources on like how to prepare them and make sure they're soft but not too soft or hard but not too like anyway, that
Yeah.
can be really resourceful. So how can parents tell when their baby is ready to move from if they're doing purees or if they're doing something more like the bliss and they're kind of in between? is there a way for them to tell that their baby is ready for more textured foods? Like, do we have to look in their mouth and see, are we moving side to side yet, or what's going on?
No, you can just call me and I'll help you with
Okay,
that.
good. Okay.
But I would say, yeah, I mean, you definitely can. That was a joke, but anyone can observe their kids' behaviors, right?
No, but I don't know what I'm
Yeah,
looking at.
but you don't
Like
know what you're looking at.
the tongue's
Yeah,
going everywhere. I don't know.
and I will say so that that first earliest chew, that just up and down, right? So again, as we're maturing, we're moving to more lateral and side to side movements. The first just up and down chew is called a munch. You can get a lot done with a munch. You can get a
Love
lot done with
that.
no teeth. You
Yeah,
can
yeah.
so I have seen some kids really, eat, and it's often children who have a strong preference for something, like they really like, fries or chicken nuggets or something, but just because that's the food that they prefer doesn't mean that they're eating it super effectively.
Uh-huh,
So
uh-huh.
anyways, that could be a whole other episode probably. But
Oh,
um
how to get my preteen to slow down her chewing? I
yeah,
remember telling her,
exactly.
I'm like, I think, is it what, 20 chews or something? Something like that before you
It's something like
swallow?
that. Yeah,
We
yeah,
should be chewing a lot more than most of us are.
yeah,
And she was just inhaling it half the time. And I'm like, do you know, like, this is how many times you chew? And she just got annoyed at like chew number five. Like, no,
yeah,
I'm busy. But
yeah.
anyway, that will be another episode another time.
Yeah. So a few things that parents can think about is efficiency of the meal. So generally we'd expect a meal to be somewhere between like 20 to 30 minutes. If it's taking your child a lot longer to eat, it could be a sign that they're not that the food textures are a little bit more too difficult for them, or that something else is not efficient about the eating. The other thing to be mindful of course, with kids is weight gain. We eat for lots of reasons, but we want to see children, not just maintaining, but gaining weight and following their growth curve. And again, children who are having difficulty kind of like, I almost want to say like keeping up with their curve in a way, that could be another sign that, okay, like we've pushed them a little bit too far with a solid, we need to take a step back.
Mm,
Um, so those are two kind of top like safety things I would say.
hmm
Oh, I had one more for you, but will I remember what it is? Oh, we talked about gagging, and again, how the gagging can be just like falling when you're learning how to walk. And again,
hmm
I don't want people to, be out there scared of like, gags. But if the child is like really gagging throughout the meal and again is unable to finish, it's affecting their efficiency, could be a sign that the food texture is also not a great match for them and their
mm.
skills.
Yeah, like a
Um,
gag here and there, like you said, pretty common, normal. But if it's like the whole meal or it's time
yeah.
after time, okay, okay.
Or again, if it's like just to stick with the apple, although it's not one that I have typically seen a lot of gags with, but if you're giving your child like, something like that slice of apple and they really can't get it down, like I would just take it and modify it a little bit if they're really, gagging, coughing, choking. Those are, they can also be signs of kind of safety risk. So
hmm
I would consider modifying the food down, but also like seeking a professional to help. A lot of the children who have feeding difficulties that I see are medically complex. So they have other developmental,
Right.
neurological, sometimes disabilities. And so it's really, you have to be really conscious with those kids. Like again, I do believe in challenging, and that's how we grow any skill, as we challenge and we push,
hmm
forward, and we try things that are more difficult. But you don't want to challenge so much that your child is, unsuccessful at meal times. So
Mm,
yeah.
okay, okay. Um, so what are some practical ways parents can encourage and support chewing skill at home? So if maybe they're just getting started with this or just wanting to know how to best support their little ones, which a lot of us do. We're getting to a new stage. It's like, okay, what do I need to learn here? And maybe we don't all have to go see a speech language pathologist, but definitely still some things we should probably look out for. So, yeah, do you have any tips for the parents
Yeah.
out there exploring this?
Well, again, I love the exploration in the mouth with like toys and different things, as you were mentioning, Ashley. I do think that is helpful. The other thing that I really like in my toolkit for building those lateral movements that are important for chewing are those little baby mesh feeders. You can see them
Oh, yeah.
everywhere. I've seen them at
Yeah.
grocery stores, I've seen them at pharmacies, but they're little pieces, typically of like silicone or mesh, and you put a whole food in it. Like you could put a strawberry or something like that.
We would do
And
bananas that way. So it
yeah,
wouldn't, yeah, because like you want to give them a banana and it's kind of soft, but at the same time, if it goes down the wrong way, it's not
yeah,
pretty. Yeah.
exactly. But the mesh and the silicone lets them get like little bits of the food out. It lets them move the food around their mouth.
Mm.
And I find those can be really helpful in building those early skills. The other thing which you could try if you're kind of doing purees and maybe like plateauing on purees, having difficulty moving forward.
Hmm.
I will take a bit of puree on a spoon and I will just kind of swipe it on the inside of a cheek. So you just kind of put the puree and the spoon on the
Right to the
inside,
cheek.
right
Okay.
to the cheek, like yeah, like just right on the
Like you're going
inside.
in on an angle. Yeah. We're
You're
trying
going
to
in on an
describe it
angle.
because we know there's no video.
Yeah, exactly. But yeah, you just kind of want to get the puree on the spoon, coat the cheek almost, and then that will allow your baby to move their tongue over there and kind of get some of those side to
Oh.
side movements. Yeah,
Okay.
yeah.
Okay. So
So
we just want to
that's
be able to, that's going to help encourage them to do that, but also for us to see like, okay, you can do that.
yeah,
And we're getting
yeah,
there. Okay.
yeah,
Oh, very
exactly.
cool. I
Yeah,
love those little mesh things. Though
I do too.
I did get like I did question myself about the banana though, because to clean them out was really that
That's
was a fun part.
that's the worst part is cleaning them out. I will admit I use the mesh myself and not the silicone, and I don't know if the silicone is easier to clean, but yeah,
It
the
must
food
be.
always gets stuck. Yeah,
It must be.
that must be why someone invented it.
Still though, it's great. I love that was such a good we did a combination with all three of our girls and it depend like they were all a little bit different in terms of when they were reaching those milestones, but you know, give or take 6 months. But I remember one of my kids just like that tongue thrust was still so like like
Hmm.
she seemed interested, but it was that reflex was just not allowing it to happen. So that was like, okay, maybe we'll slow it down or try again next week or in a couple weeks or
Yeah,
something.
yeah, and I think there are kids who just need more time to practice these skills.
Yeah.
Um, and there are kids who, take a longer time to learn how to speak and communicate as well.
Yeah.
What I really like, the message that I want to give is to families is you know, if you're not meeting those milestones, if you have concerns, like there is help out there for you finding a professional. I'm a speech pathologist, so of course I'm going to mention speech language pathologists, but there might be other people in your area. Like there are lots of great occupational therapists doing pediatric feeding as well, and
Hmm.
kind of working in the same way on skill building and things like that. So just like finding help, finding a team, but yeah, and you're right. Some kids just need more time, need more practice.
Hmm.
I also really I spend a lot of time because I'm really passionate about rehabilitation, reading and learning about how we learn things, how we teach people things. I use a lot of like exercise science and things like that when I design my feeding programs for children and for adults. And one of my favorite pieces of research about pediatric feeding relates pediatric feeding to something called dynamic systems theory, which is this like theory of development and development of motor skills that talks about how it's not like linear, it's not a straight line, right? And we
Hmm.
again, I
Hmm.
don't think we expect this with really any area of pediatric development, right? You might see your child able to kind of like, stand and crawl and do different things on one day and the next day they're falling everywhere. It's
Hmm.
the same thing with feeding. Like we see sometimes like little steps in a direction and then it almost seems like there's a setback. But they're just learning and they're figuring things out, right? And it's not like a skill is necessarily even going to be consistent from one day to the next until it's mastered, right? So when
Mm-hmm.
we're learning that mastery and when we're learning how to chew, there's going to be days that are not as coordinated, not as successful, and then there are going to be days where they're really shooting up. And I think that that's something that we're becoming more and more aware of in development, because we do have this tendency to think about like milestones, steps to acquire a skill, but really that's the finish line, right? Like there's a
Yeah.
mess in the middle.
Yeah,
So
yeah.
yeah,
I remember sometimes I talk about this, any kind of milestone, or we talk about babies and their leaps, these developmental leaps. But when we
yeah, I like that
see the
image.
skill, they already did all the work to get to that point. And so, like, we think, oh, they're learning this or this just happened. So they must be going through, but they've been going through the things
Yeah,
already to get to that
exactly.
point. So that's
Yeah.
like more of the result of all the work that they've put in. Yeah.
Yeah, no, I
Yeah.
really like that way of thinking about it too. And it's not always a straightforward path. But yeah, they're like I think if your child isn't hitting milestones, it's very stressful for families.
Yeah.
And so just like finding someone who can help. Yeah.
But there is a range. There's such a range. And that's why it's like,
Mm-hmm.
oh, they're not doing this by this time, like period. There's a range. And with my three kids, and they've done this for when it comes to their growth, when it comes to their milestones, when it comes to so many things. My first child was sort of at the 90 something percentile. She would hit milestones kind of when you expected them. Or sometimes, no, I wouldn't say early, but like it would be like right when you'd think that that could be possible. So she was kind of early. My second child was on the very end of those ranges. And they were both born in the same month of the year. So it was so easy for me to get caught up in like, oh, but my first baby was doing this by July and this one's not even close. And you
Yeah.
can get so caught up in all of that. But my second child, she was in the fifth percentile. She did things a lot more slowly. And she still kind of does that to this day. My middle
Yeah.
child, she just does all the things on her own time. And I
Yeah.
don't even keep track. But that those ranges, but how stressful it can be if they're not okay, we're at 6 months. We're supposed to be starting solids, but they're still sticking out their tongue. They're not able to sit up totally unassisted yet, but that's okay. They might just need a little bit more time.
Yeah. Yeah.
One of my last questions. What's one myth or misconception about babies and feeding that you wish every parent knew the truth about?
Yeah, this is a good one. I don't know if I have one answer for this because it's so I feel like there's so
You can give
many.
us more. You can give us more than one.
Okay, I might give you more than one. I would say that feeding and swallowing is a lot more about coordination and motor skill than it's generally about structure. Yes, again, we can have children with tongues that are like just a bit large for their mouth, like the Down syndrome example that I just gave. But I have seen kids with anatomical differences really, still eat, swallow, chew effectively. And so it's not, it can be tempting to look for like a structural problem, but feeding is a motor skill. So
Mm.
thinking about how we're learning those skills and that it's not always structure. And in my opinion, a minority of the time, it's actually structure. It's more often skill.
Can
Um,
sorry, and I know I'm taking you away from this question, but now I have another one. Because tongue ties is
that's
such a
exactly where I
big,
was going. Yeah.
was it? Oh, thank
Yeah.
you. Because that's such a big worry for parents. I certainly get questions a lot prenatally in our classes because somebody knows someone or you're just hearing about it. And so sometimes I'm asked like, is who's going to check if my baby has a tongue tie? Or can the nurses look at this? And I always say like you probably need like a lactation consultant. You want somebody who's very
Yep.
skilled because it's not just about the presence of this quote unquote tongue tie, but it's a, can they function with it or without it, or how is
Yeah.
that working? Because there
Yeah,
are some
absolutely.
babies or kids that have had tongue ties where they're not sort of I hate that they use the term corrected, but
Yeah.
they haven't like worked on them or haven't had to do any procedures, and then they still have a great function going
Yeah.
on. So yes, please talk to us about where tongue ties land in all of this.
Yeah. So very strong opinions, I would say, on like both sides.
Okay.
I think that when we look at the evidence, and we do have someone in Nova Scotia who recently just, I believe, moved back. But we now have Dr. Elise Graham. She's a pediatric otolaryngologist at the IWK. She has so much expertise in tongue tie, and has done a lot of work evaluating the research and, if we release, or as you say, correct a tongue tie, like what does that lead to in terms of like different outcomes. The
Yeah.
strongest evidence is related to breastfeeding. So I would agree with you if you have
Yeah.
concerns about it. It's often related to breast or chest feeding. Going to see a lactation consultant can be very helpful. And there is research that shows that those tongue tie corrections can make breastfeeding more effective. When you dig into the research, it's actually often related to like maternal pain, which is interesting. So it's
Mm.
there can be a number of reasons why people discontinue breast and chest feeding, but pain is one of them.
Hmm.
And tongue tie release can help with pain, which is interesting, and not, I think, what we're it's interesting again with pediatric feeding. We're often so focused on the child, but it's like sometimes there's
Mm.
a combination of factors. There's environment and whatever. For speech and language, it's my opinion that there's very little evidence for it helping, and you really need to be thinking about the sound. So in English especially, there's sometimes multiple ways that we can produce a sound. Like there's multiple ways you can produce S. For one of them, you do need your tongue like up nice and high, but for another one, you can put your tongue kind of lower by your bottom teeth and still make
Okay.
the same sound.
Okay.
So for speech and language, I would say, again, before doing any sort of release correction procedure, I would get an evaluation and see if there's another way that you could do it. Where I struggle with tongue tie is, again, I feel like a lot of families or parents expect that this is going to be the solution to all of the feeding issues. And
Mm.
then
Mm.
when it
It's not
doesn't,
always.
it's
Yeah.
not always. Yeah.
Yeah.
And what um, I think that also if you're trying something multiple times and it's not making a difference. So I've had children on my caseload who've had tongue ties released several times, and there's been no impact to their feeding.
Whoa.
So
Wow.
at that point, I'm wondering as a professional, like, is something else going on? My opinion is yes, it looks like skill,
Yeah.
and yeah,
Yeah.
so yeah. But there could be other things too. Like there could be I've seen children with syndromes that impact the development of their teeth and give them like really dry mouths and give them, and that makes it difficult to chew and swallow because if you don't
Right.
have well-formed dentition, if your mouth is really dry, food's going to adhere to it. So I think that that's another risk when we're looking always for like one specific answer. We might be missing something else. So
Yeah.
yeah,
Oh, that's so interesting. I do hear that sometimes, like the tongue tie thing is so huge. And rightfully so, because especially if it's your first baby, it doesn't matter if it's your first baby or not. You have a newborn, and if
yeah,
you're in pain, anyone who's breastfed and has been in pain can attest to how awful it can be. And like, but whether it's the pain or not, but if we see that baby's not gaining weight as they could or should, or um, they do seem to struggle with the feeding in some way, then we do think that if there's a presence of a tongue tie or lip tie or all the things, that must be what it is. But it's really about the function. So finding a professional, that like a
yep,
lactation consultant or maybe someone like yourself, that's like, hey, but can we still function and can we just work with this? Um, what about if they're because I know someone in this scenario, or they used to be, when they started introducing solid foods to their little one, 6, 7 months old, and she noticed she was squirreling away her food back in her cheeks. Or that's
yeah,
how she would joke about it. Oh, she's saving it for later. And then my thought was like, can she get it though? Can she reach for it? And so I asked her about like, was she ever assessed for my thought? I'm not the expert in this, but she's just a friend of mine. And like sometimes we see that with babies who have tongue ties because they can't actually reach that way. But what would your opinion be on that? Would that be a likely scenario, or could that too be something else?
Yeah, that we call that pocketing often. So the food is just like sticking inside. Well, it's getting
Hanging out in their
lost in the
cheeks.
cheek.
Yeah, yeah.
Yeah. You see that in babies, but you also often see that a lot in seniors with difficulty chewing. So if you go to like a retirement or a long-term care home, especially if you're on like a memory floor, you might see a lot of people saving the food for later.
Mm,
It could be structural. I often find that again, it's an issue of like getting that full range of motion of the tongue. And sometimes I've also seen it in people who have, I would say that they're not super reactive or sensitive to the sensory information of the food. So again, I'm thinking about my dementia population. Sometimes we see it in children with autism, and it's like they're really having to fill their mouth with food to kind of get the coordination, get the sensory input of the food, right? Because with something like autism or a sensory difference, you can be hypersensitive, but you can also be hyposensitive.
mm,
So when I see a behavior like that, or like it could be anything related to feeding, there's like 50 possible explanations in my mind, and I'm like, which one matches this person? So yeah, it could be something restricting the tongue movement, it could be coordination of the tongue, but it could be a sign of like sensory issues. It can mean a lot of things, but if it's not resolving and if it's impacting meal times, that's also can be a kind of scary one, because I've had families who will find that like much later, like when the child is going, to sleep, and we're getting ready for bed and we're brushing the teeth, and then we find the food. It's like, oh my gosh, like how long has this been here? We
mm,
don't we
mm-hmm,
don't want food and things kind of sitting in the cheek around the teeth for like cavities and dental reasons, but
mm-hmm.
it is also just a safety thing, right? Like all of a sudden your child's running, and then where is that food going?
Yeah,
So yeah.
yeah. Well, all the more reason I think this has just been a wonderful theme throughout this. It's every person is different, and having being assessed by a professional in the field of feeding, chewing, like these kinds of things can is so important because that's where we get stuck with like, oh, well, we release the tongue tie and everything's great. So somebody else goes and does it, but it's not
Not,
great.
yeah.
And so we get so frustrated with that, but all the more reason to find people like yourself that are can help assess and help you figure it out.
And I think that's my other big myth, is that these are things that I've heard people say, like with pediatric feeding, it is what it is. Your child, if there's like a difference or a disability, I think sometimes people read the literature and think like, okay, well, we see autism and feeding co-occurring autism and feeding difficulties. So that means that my child is going to have trouble. And I think sometimes parents feel like there's not a lot that they can do.
Yeah, yeah,
There's a lot you can do. And so finding a professional that, can help to assess, but can also help you to build those skills and push your child forward. Like that's my love in feeding, is like building those skills and building competence and
yeah,
confidence in kids and families. So I would say that's the other myth. I think sometimes people get discouraged, and they might get messaging from certain professionals that like, oh, it is what it is. They're going to
right.
have these difficulties, but the research does support like pushing those skills, building those skills, and skill development. And there's a way to do that that aligns with like again how we learn any motor skill.
Right,
So
right.
yeah.
That's definitely something I would not feel confident doing my on my own. Let
No.
alone sometimes let alone with a healthy child that doesn't have any other issues that could be affecting that. But like, I think everyone, they could just kind of need that individual attention. Or if you have someone that's guiding you, a professional to help you with the pushing part, to give you more confidence and to say, this is what to look for, this is what we don't want to see, and kind of thing. Like, that's, I think we all need that just to
Yeah.
be able to move forward and not just make it like a, oh, this is just how it is. So we'll
Eh,
carry on.
and my version of push is like a pretty gentle push. Like, I sometimes with
It's a
it,
nudge. It's a
it's a
little,
nudge. Yeah.
yeah.
Sometimes
Okay.
with families, it's like we're just working on when feeding is hard, that's when sometimes we see a lot of behaviors come out, right? So
Yeah.
that's when the
Yeah.
food is being thrown or there's a tantrum at the table because the child's not feeling successful, right? And
Yeah.
so with some families, it's like, okay, we're going to work at sitting at the table for like 1 more minute and we put a timer. Like that is sometimes the nudge. But yeah, like you can build these skills. There is help. There are people who have qualifications and skills and would love to help you. So, but I agree with you. And I think typically developing child or, child with, developmental or other disabilities, it's scary when you're having feeding
Yeah.
difficulties. It's
Yeah.
scary when your child's not gaining weight, when they're, if you're worried about choking or gagging or things like that. But
And
I
that can
agree with you.
prevent us from pushing forward. That can prevent us from going
Yeah.
there. Yeah, for
Yeah.
sure. Well, speaking of all of that, Juliana, where can people find you? Where are you on the internet? Where are you located? Tell us where people
Yeah.
can find you, and I'll throw the links in the show notes so it'll make it easy for people to do
Yeah,
that.
thank you, Ashley. So our clinic is physically located in Bedford, in the Bedford Commons. You can find us online at onebiteatatime.ca, and it's the number one, like the digit one. We also have a Facebook and Instagram. If you go on our website, there is a link to our Jane booking, and there you can also book a discovery call with a member of our team. So if you
Beautiful.
Yeah, and that's totally free. So if, I encourage any parents who have specific questions about, their child, about how they can support feeding, it's a free 15-minute phone call, and we're happy to chat and give people
Th-
more
That's
information.
awesome. Just to see, hey, can you help with this? Yes, no,
Yeah,
okay, let's make an appointment or maybe refer somewhere else. So that's awesome. I love that.
yeah, exactly. Yeah.
Okay, cool. Well, we'll put all that in the show notes. Thanks so much for joining me today. This has been really informative and super helpful. Was there anything else that you wanted to get out that we didn't talk about or?
No, I think we got pretty much everything.
Okay,
Did
awesome.
I send you a link to the Holland Bloorview milestones? Because I should send you that because I
No, but
referenced
I
it.
actually wrote it down. I would love the link to that because I'll put
Okay.
that in the show notes as well. So that's where people can go. This is what you reference for when to expect certain milestones to happen. Is that
Yeah,
right? Okay.
exactly. Yeah. So it's a really nice document. Yeah, there are other like good websites out there, but I like this one because it's Canadian. So, and it also has like your child is doing this, so this is what foods you could consider feeding them. Like it can
Oh,
help
no
answer some of
way.
those questions.
Oh,
Yeah.
very cool.
Yeah.
Okay,
Definitely,
cool.
yeah, not as comprehensive as like Edwina or My Little Eater for sure, but like it's a good way of relating the skill that they have to the types of food that they could be eating. So,
Right, right.
yeah.
Okay. All right, awesome. Well, we'll link to that too. Thanks again, Julianne. This has been
Oh,
awesome.
thank you. I really enjoyed it. We'll see you later.
If you're looking for more information or support along your parenting journey, check out birthbabysleep.ca. That's where you're going to find prenatal classes, postpartum and new baby resources, and sleep support during the childhood years. Lastly, but certainly not least, if you got something out of this episode or our show in general, leaving a rating or a quick review goes a really long way to helping others find us. So please consider leaving one. That's all for now. I'm Ashley Cooley, and we'll see you back here next time.